names is Shawnee McDonald, and we're group 13.
Hello, I'm Sterling Simmons.
Avery Canty. Josh Irving.
Kyle Zachary.
Karen Grigas. We did our project on obesity in the population of American Indians and Alaskan Natives. It was based on health literacy, and we named it Obesity Overweighted. So what we decided to do was we decided to do a convention to do like health literacy based on people who don't know much about obesity, like the Alaskan Natives. So how we prepared it was we got health professionals, nurses, nutritionists, and doctors, so they can like help them and guide them and teach them things that they need to know. And we have a zip code, and it was 98103, and we found a Yesler Community Center there that can hold the convention. Our funding came from BMIs and scales, and we also got Fitbits for all the people that came. And our partnership was Partnership for a Healthier America, which is actually from Michelle Obama, and she did it for schools and like healthier foods. We also did a free month gym subscription for Anytime Fitness, and we did Madison Market, which is a healthy food market, and we were sending out gift cards. So our SMART goal is through the collaboration of Partnership for America. Like I said, it's Michelle Obama's thing, and it says that we're going to assist them with increasing their health literacy, so BMI and weight and things of that nature, like exercising and eating clean, and this is going to help them like prevent obesity and improve their quality of life.
So how can you start living a healthier lifestyle? Things that we came up with are, as our objectives, you can increase health literacy through a patient education health convention. You can decrease the prevalence of obesity within the American Indian / Alaska Native population. You can promote healthy living by providing incentives, as Karen mentioned, such as gym membership, Fitbits, and gift cards. You can establish and foster the importance of controlling calorie intake, blood pressure, glucose and cholesterol levels, and BMI. And then you can also decrease morbidity and mortality rates attributed to obesity. So as far as the description of our population, the percentage of American Indian, Alaska Native is 0.6%. The education level, 59.8% are high school graduates or higher. 6.1% have a bachelor's degree or higher. There are 2 school districts, the Archdiocese of Seattle and the Seattle School Districts. Currently, the Seattle public school system has an average school rating of 6.6 out of 10. This school rating is based on data from test scores. And median household income is $91,000. And 7.8% of individuals live below the poverty line. The zip code, 98103. The population of the zip code is 45,000, or approximately 45,000. The median home level income is 478,000. The median age is 43 years old. The amount of American Indians / Alaska Natives is 0.6%, as we mentioned on the previous slide. The zip code is dominated by singles, which is 40%, versus families is 32%. There's more renters occupied than home ownership. The average household income is 60 to 99,000, and the average individual income is 100,000.
So obesity is defined by the National Institute of Health as having a BMI of 30 or greater, and the goal of the BMI is to have either 25 or less. If it's less than 18, you're underweight, and if you're 25 to 30, you are moderately overweight. So we want to be in between 18 and 25. And then you have the diseases that are exacerbated by obesity and can also be caused by obesity, such as cardiovascular diseases and type 2 diabetes and cancer, osteoporosis. Many people in the world think that first world countries, such as the United States of America, are the fastest growing populations of obese people and have the greatest populations of obese people, but that's not true. The fastest growing populations of obese people in the world as of right now is the Middle Eastern countries. and there are more obese populations in developing countries versus developed countries. So our convention, our program, what we're going to do is we're going to have an convention at the Gessler Community Center, and we're going to showcase how to teach all our population about health literacy. So we're going to have, like we said earlier, doctors, nurses, and nutritionists, and they're going to come out and measure our patients' BMI and blood pressure, and it's going to assess what stage of obesity that the patients may be in, and based on what stage that they may be in, whether it's underweight, overweight, or if you're in the normal range, that's going to affect directly your treatment and how to either treat your obesity, how to prevent your obesity if you're not yet obese, and what medications you should or may not be taking. Nutritionists are going to teach our patients about how to read nutrition labels, and then that's going to directly affect how our patients are going to be able to read what foods that they can and can't eat, and which ones are going to be good for them and which ones can't be good, because many people don't know how to read a label and if the food for them is good or not. And then we also have a partnership with a local gym, and they're going to give the free memberships, and we partner with the local community, the market, and they're going to give out free gift cards, so as an incentive to give our patients easier access to expensive organic food.
Okay, so part of our convention is to definitely educate on how to understand the My Plate diagram, meaning that half of your plate needs to consist of vegetable and fruit, less than a quarter of your plate needs to consist of protein and grains, and then of course a dairy product. And of course reading a nutrition label is important. For example, to start reading a nutrition label, first you look up the top and look at the serving size. So this is an example of a macaroni and cheese, and this contains 2 serving sizes, so everything on the nutrition label will be doubled, so that's important to take that into consideration. And as you go down the nutrition label, we get the different nutrients, including fats, cholesterol, sodium, and fiber, and the different nutritional vitamins. Some important training we're going to be doing in the convention is to counsel on which foods to eat, which are unhealthy and which are healthy foods, and what's the difference between foods that contain bad cholesterol, good cholesterol, and also teach how to manage dessert intake. And also for drinks, we may not be aware, but sugary drinks can contribute to obesity, so we're going to avoid the sugary drinks and counsel on how to increase water intake instead of sugary drinks, and of course adjusting portion size and following the My Plate diagrams. So on a cultural perspective, Native American healers believe that a person is healthy when he or she is in harmony with the environment. And it is Native American tradition that food is their source of health, often referred to as medicine. So again, it's important to appeal them culturally. We're going to reinforce those beliefs. And again, counsel on refraining from drinking too much alcohol, decreasing food portions, minimize red meats, and minimize sugary snacks.
All right, it's all about savings here. Obesity is one of the biggest drivers of preventable chronic diseases and healthcare costs. The reason being is just because obesity has so many risk factors, like as stated earlier, like cardiovascular disease and like cholesterol and whatnot. So you're using most of your money spending it on the treatments of those diseases. That's basically summing up this slide here. And then outcomes we want to be achieved. We want weight loss, healthy lifestyle, understanding food labels, and understanding BMI.
Okay, so the role of the pharmacist, basically you want to look at the overall view of the disease state. You want to find out who, what, when, and where, and also you would like to provide non-pharmacological treatment, such as increasing physical activity, consuming adequate water intake, and also limiting the consumption of foods that has high fat content. The impact on the population of our project is going to be positive. We'll be decreasing the medication costs of obesity-associated illnesses, as well as improving health outcomes in the overall health of the Alaskan Native population. And then our bibliography. Thank you.